medication, nutrition, or anything else until proper placement has been verified. Now, if it hasn't been verified radiographically or fluoroscopically, okay, either way is X-ray. If it hasn't been done either way, they can also do another way. Let's just say, for instance, they needed the results immediately, but the radiology department, sometimes it happens, gets bombarded with other procedures, and they can't wait for an X-ray to be done. What they can do is the tip of the tube, they've connected to, at the other end, they'll connect it to a syringe and just take a sample of it. Send that sample to the lab. You guys remember the pH we were talking about earlier? If they take a sample of it, and the lab says, okay, it's about a 3 or a 4. What does 3 or 4 mean?
Acidic.
It's acidic. Is your stomach acidic?
Yeah, very acidic.
Your stomach is very acidic. That's what assists in breaking down the food and fluid contents in your stomach. It's very acidic. Yeah, you guys all vomited before, right?
Unfortunately.
Unfortunately, right? And so when the vomit comes out, it is in a very, very acidic, citrusy, vinegary. I mean, you know what I'm talking about, right? That's your stomach, okay? So if it comes back below 7, you're in the right place, okay? So in the stomach, the number is going to be very low, very low. Well, what if they went past the stomach? Let's say in the small intestine. If they go into the small intestine, it's going to be still below 7, but it's not going to be as low as it is in the stomach, but it's below 7. If it's below 7, it's still acidic, right? So that means it's still in the right place. Now, if it went down the wrong pipe and into the trachea, okay, you're not going to get anything below 7. It's going to be above 7. You follow? So if it's above 7, they better know right away. They better not use that because it's somewhere in the windpipe or in the lungs. Okay? Greater than 7, it's in the respiratory tract. Okay? Any questions? Alrighty. Okay, special type of tubing, not through the nose. Again, if they're having some problems here with the mouth, the nose, the throat, okay, we're going to bypass that and go in a different route. This is going to be a route through the abdominal wall and directly into the stomach. These are known as gastrostomies tube. Gastrostomies tube. Gastro, stomach, stomy, it's a hole, right? An artificial opening, a hole. A stoma. So, stomach, hole. Okay, surgical opening, we're going to go through the abdominal wall, place the catheter, tip of the catheter inside the stomach. Okay, this is balloon inflatable, so there is a balloon up there to prevent any dislodging, but there's also a plastic plate that we can either tape down or suture up. We're most likely going to suture that with a balloon, okay, because these are very hard to place in the stomach. So if they get dislodged, trying to get it back in, it's tough work. So they'll sew it onto the skin. Okay? Just like the urinary catheter, remember the suprapubic catheter? We want to make sure that the wound is clean and also dry.
With this one, because I know someone who's had one and they did it when he had a stroke. Why would they do that when a person has a stroke?
Because if they had a stroke, their swallowing mechanism isn't good.
Okay. Can't control.
Yeah, they can probably chew, but they probably can't swallow properly. So if they don't swallow it properly, instead of going down the esophagus, they usually aspirate it.
Okay.
All right, so it goes down the windpipe. So that's why they will do it. Okay. Any questions? All right. Suction. So we'll hook up one of those feeding tubes to a suction, mechanical suction. This will remove any gas buildup, any secretions, any fluid buildup. Okay. When hooked up to this machine, you don't want to exceed 25 millimeters of mercury of pressure. That's a lot of sucking power, okay? Because not only will you be sucking up any contents, but you might also be tearing up the mucosal wall and damaging that, okay? So nothing to exceed 25. All right. Is this something that you do on your own?
Nope.
Okay. Who's going to direct you?
Nurse, doctor.
The doctor's going to tell you exactly the sucking power that you need. Okay? Do not take it upon yourself. Because if something happens, it's on them, not on you. Okay. Other types of catheters and tubings. We kind of talked a little bit about this before. It's known as a CVP. A central venous catheter or port is a CVP. This is an overglorified IV. Remember we talked about PICC lines? Similar to a PICC line. So you can instill drugs, you can draw blood, but it's a special type of catheter in which we can also feed or provide nutrition to our patient through this overglorified IV line. We're going to take a break after this. Okay, so this catheter goes through the skin, underneath the clavicle, okay, or it can go into your brachiocephalic vein, but the tip of the catheter ends up in the largest vein of your body. What is that largest vein in your body called?
Vena cava.
The vena cava. It can be inferior, it could be superior, it doesn't matter. But the tip of it ends up in the vena cava. It's the largest vein in your body. Okay? When they do a line like this too, we want to make sure that it's in the vena cava. The vena cava is usually just right around here. You see the heart shadow? And then this right side is where the atrium is. So the line here is indicative of the line placement being placed in the superior vena cava. I know you guys are looking at this right now. It's like, I have no idea what you're talking about. Okay? Well, that's why you come into the RADT program. So you get a better understanding of what you're looking at here, radiographically. Okay? But all lines that are inserted, they're radio-opaque, so they can be visualized under x-rays. So they get a line like this inserted, we're going to take an x-ray to make sure there's proper placement of that tip in the vena cava. Okay? So again, drugs, you can push in drugs, you can pull out blood, but we can also instill medication known as TPN, which stands for total parenteral nutrition. TPN is a combination of all the goodies. You've got your glucose, your amino acids, your lipids, so on and so forth. Okay? So they are being fed through an IV. Now it won't be as satisfactory as actually tasting the food and feeling fullness.
It keeps you alive.
But it keeps you alive. Okay? So they're being fed through the vein. Okay? If you guys have ever seen TPN, it's nasty. It just looks like vomit. Vomit in an IV bag. Okay? Or liverwurst or liver pate. It looks liverish. It's just nasty. Okay? So that's what's being fed through the line and into their heart. Okay.
Liver pate is good.
I know, I didn't say it was bad, it just looks nasty. I love liverwurst. I love liver, well, I don't know about liver pate. Okay.
Goose pate.
Oh yeah, goose pate. I'm gonna take a break, guys. I need to catch up on my breathing. Okay, so let's take a 5-minute break.